Hello and welcome to Healthline 3. I'm Terri Simmons. Today we're talking with Dr. Hollie McCart of Willis Knighton Pierremont OB-GYN Specialists about general wellness screenings and cancer screenings for women. And a reminder for you, please make sure you're in a quiet room with your TV turned down really low to a low volume when you call in so that we can hear your questions. And the number to call is 318-219-4569, and you'll see that on the bottom of your screen throughout the show. Thank you so much for being here, Dr. McCart.
Thanks for having me. I'm glad to be here.
So we're going to be talking about overall wellness screenings, mostly ones for women. So let's go ahead and start with breast cancer screenings. What's the recommendation for that?
So the current recommendation for breast cancer screening is that you could consider having your breast cancer screenings start at age 40. Depends on the guidelines that you and your doctor find that fit your goals and are appropriate for you given your risk factors. So considering starting at age 40, but definitely by age 50, all guidelines agree that women at age 50 should definitely be having their mammograms, but starting at 40 is certainly something to consider and can be recommended.
Okay, and we've talked throughout the morning too about it just being very individual. It's not necessarily that everyone needs to go annually. Some need to go more often than not. Is there, and there's nothing to be alarmed about that.
No. Definitely guidelines show that you should be having at least a yearly breast and pelvic exam with your gynecologist. That gives you all a time to talk and make sure everything's okay. And so that's normal. That should start anywhere around the early 20s that you're really seeing your gynecologist at least once a year. And then certainly if things come up, you see them sooner, and they can be ordering your screenings as appropriate.
Okay. And what about ultrasound breast screenings, along with or opposed to? Are they ever instead of mammograms, or do they go with it?
Sure. So some women have denser breast tissue than others. We see this a lot in younger women. And so if a younger patient comes to me and has a lump that they're concerned about or I'm concerned about, sometimes the better imaging, at least at first, is to get an ultrasound. And so that you see a lot of times with younger patients, but even in older populations, sometimes we need an ultrasound. Maybe there's a biopsy that needs to be done. And that's often ultrasound guided. And so there's a lot of imaging modalities, and it's great because we, again, can kind of tailor for what the patient needs.
Yeah, it's really nice to have that option.
It is.
Yeah, so it doesn't mean necessarily it's anything more to worry about. It's just depending on the tissue. It may be too dense, and you just want to really get a closer look.
And there are times where you can get a breast MRI as well. Some patients that are on more frequent screening regimens actually alternate between a mammogram and an MRI every 6-ish months. And so, again, just really depending on your risk factors and your history, you may be falling into that group.
Okay. And so just always just talk to your doctor about it.
Absolutely.
Just really at length, just find out really what's particular to you to find out the best. Now, if someone has family members who have had breast cancer, is there something different? Like if I came into you and I knew that was in my history, is there anything different that I would do with my mammogram or information? Yeah,
it depends on your family history. How many family members, how closely are you related to them? Is it your mother? Is it your sister? Is it your great-great-grandmother? Certainly all your family history is important, but depends on your family history, your risk factors, if you've had any kind of genetic testing. Sometimes you're going to have more frequent screenings, or sometimes that if you're in a high-risk group, you could even have prophylactic surgery.
Okay. And so why is it specifically, let's remind us, why is it really important to know your family history when it comes to breast screenings, ovarian cancer, any kind of things like that?
So over the years, we found that certain cancers can actually run in families, and we started to notice that a lot of these certain cancers were kind of traveling together within a family, and so that tipped us off that this may be genetic, and turns out that some cancers can be, not all cancer, but some can be. And so it's important to know if you have several family members that have a history of cancer, what type of cancer, what age were they diagnosed, male and female is important, and that can actually tip us off that maybe we should do some genetic testing, and if there is a gene there, that we can identify it and then know what we need to do next as far as screening.
Okay, and let's talk a little bit about genetic testing. What does that entail?
So it's very interesting. It's definitely kind of the leading edge of medicine right now is individualized medicine and genetic testing, and it can provide the patient and their family a lot of information. And so if we identify these certain genes that say for example, it says that if you have this gene, you're increased risk of things like breast cancer and ovarian cancer, you can talk with your doctor about, okay, How often should I have these screenings? Should I have a surgery that will decrease my risk? That's a very popular topic right now, and something definitely to consider. Not required, but is an option, and you need to know your options.
Right. And so that's even if you're feeling healthy, say your mother maybe is diagnosed with ovarian cancer or something, if you want to go get genetic testing to know, there's things that can tell you that you might be not necessarily anything to worry about again, but if you ease your mind to know that it might be, you might be prone to.
Yes, and as these tests are more and more available, the ideal order to do this is actually to have the patient who has the cancer tested. If for some reason they don't want to have testing, and that's okay, or they're not able to have testing, then you would start to test other family members. And so say a healthy patient who has a family history comes in, gets a genetic test done, they come back positive. It not only affects them, but then we should start talking about perhaps should their children be tested, because as we all know, genetics and DNA is passed down to your children. And so if you're positive, then you should consider should your children be tested, and then again would increase their screenings and be able to stay aware and hopefully detect either precancerous or cancer in very, very early stages, which is important.
Yes, it's so important, and with all that we have now available with our doctors, just knowing that we can talk individually about that and specifically, and then all of the tests that can be recommended. And especially something like, is it true, like ovarian cancer, for example, that might not be, maybe there's a special test specifically for that where it might not be picked up if it's just a general screening for cancers. If you know there's something specific maybe you can look for.
Yeah, and ovarian cancer itself is a little tricky. There's not a good screening for ovarian cancer, unfortunately, like we have mammograms for breast cancer. We don't technically have that for ovarian cancer. So that's more dependent on your exam. That's a reason pelvic exams are still very important. And also symptoms you may be having, that's always important to discuss with your doctor.
Okay. And what are the options to decrease the risk if genetic testing is positive?
So more frequent screenings is one of them. That's very important so that you're a little bit more vigilant on the screenings. Usually your regimen's a little bit closer together than just your typical risk patient. And then also you have the option of undergoing a risk-reducing surgery or prophylactic surgery. That was made pretty popular with Angelina Jolie several years ago. If you remember, she underwent a risk-reducing surgery and was very public about that because she identified that she was positive for a genetic cancer gene that she carried. So she decided to go through with this surgery. So that really made it a hot topic in pop culture for a while. And so that could mean a prophylactic mastectomy, so removing the breast tissue before cancer is there. And then you have the option of reconstruction. It could be a risk-reducing removal of your ovaries or your uterus if you've completed childbearing. That's certainly something that's important to consider if you are identified as a carrier of these genes. Again, these things aren't required, but should definitely be discussed, and that you know that that's an option for you is very important.
It's so amazing to be able to do that. Go and have these
It
surgeries. And are things like this covered under insurance if you want to have that?
So if you are identified as carrying this gene, those surgeries are definitely covered under your insurance. The genetic testing itself, it depends on your risk factors, and so there's a lot of questionnaires that you can easily fill out even in your doctor's office to see, do you fall within these guidelines of being at a higher risk, needing testing. And so it's variable as far as insurance coverage with that, and so that's something you can talk with your doctors about. The companies themselves that do these tests are also very, very good about working with patients with their insurance. If a patient needs to pay out of pocket, they can work with them on that. And they are fairly affordable, and it can be made available to you if you need it.
Okay. And are there conditions where that it is a risk other than just being surgery? Is there a risk to having these surgeries, maybe your ovaries removed for this or a mastectomy? Are there conditions that would prevent it? Like if I wanted to do that, is there something that might prevent it in my individual case?
So for women, of course, if you're considering having your ovaries or your uterus removed, we need to make sure that you're done with childbearing. That's very, very important to many women, and that's understandably so. And so that's the timing of having these surgeries can be important. And so that's a conversation. There's a lot of fertility issues that can be discussed with your general OB-GYN or even a fertility specialist, and the options you have for that. Other than that, you know, if you remove your ovaries earlier than menopause and undergo what's considered surgical menopause, that can increase your risks for things like heart disease and bone loss. And so that's a discussion to have with your doctor. And so, you know, say you came positive with this gene and you found out when you were 25. Well, we may still consider that surgery, but we may push it out a few years to give yourself some years with your ovaries. This gives you good estrogen that helps your bones and your heart. And so delay that a few years and say, okay, we're going to consider it at 35, 40 when you know you're done with your childbearing, and gives you a few more years of good estrogen from your ovaries.
Okay. And once again, ask all the questions, because that can be an emotional,
absolutely,
physical, all kinds of
it
things.
is not a small decision.
No.
Anytime you undergo surgery, it's not, and your doctor will be definitely happy to talk to you about that, and talk through all your options that you have, concerns, questions that you have.
Yeah, it is. It's a big decision.
It is.
Something
It
like
is.
that. So tell us again, we talked about women's going for their annual exams.
Yes.
What all is typically happens in an annual exam? What's checked?
So it kind of varies by age, but just your general wellness woman's exam. One important thing is we check your blood pressure. That's also very important. And so sometimes young, healthy women who don't go to the doctor very often, maybe once or twice a year just for their annual screening, may not realize that they have blood pressure problems. So that's a big thing that we can identify is, hey, your blood pressure is a little high. Did you know that? And so blood pressure is a big one. We do a yearly breast, pelvic exam. We can do cervical cancer screening, which is very important. That's through a pap smear. We can talk about breast health. We can talk about your fertility goals, your reproductive history, your menstrual cycles. We kind of talk about everything and how you're doing as a person, and any other questions you may have. You can have your annual blood screening. Sometimes you need to be screened for things like diabetes or high cholesterol. That can also be done if needed. That may not be an every year thing that you need, but those screenings pop up from time to time. We talk about vaccine status. If you need to catch up on any of your vaccines, we go over that. So there's a lot of things that can be covered in your annual exam.
Yeah, it's very, it really is. That's your time. That's your annual exam.
It is. I tell my patients it's a time for us to really have some time set aside to really go through and make sure that we've covered all our bases and that everything is getting done. Screenings are ordered. If they need to be referred to see someone for this problem, we can talk about that at that time too. So it's a good appointment. You may not have a particular problem happening then, but it gives us a chance to really kind of take a look back, kind of zoom out and see everything and make sure everything's covered and not neglected.
Right. Such a good time to connect.
It is.
And really talk to you, because I love that medicine has grown, and from talking to you the few times that we've talked, that really is important, that overall. Yeah. When you say, how are you doing? How is everything? You really mean it's part of it. If you're stressed out, or if you have your job or your family, it's a big part of your physical condition.
Absolutely.
So be sure and connect and confide, and while we're in there, it's the typical, we have the exam. If someone wants additional testing, or they've read up on something, or they feel like it, that's the time to ask. And you know, if we can have this done today, and if not, then you can make arrangements. Or if it's something that doesn't fall under what you do, don't be afraid to ask that too. It's not specific to just this.
Sure. Yeah. I mean, I specialize in OB-GYN, so I am a little bit narrow, but overall women's health. But say a patient comes in with a concern about something else, maybe a skin issue or joints or anything like that. It may not be my specialty, and I try to stay in my lane, but I am quick to refer out to my colleagues. I have, plenty of people that work in our system that are great and willing to take care of patients, and so I'm quick to make that referral if they need to.
Especially throughout Willis Knighton and everything, it's just, don't be afraid to ask, who can I see about this?
Absolutely.
This is happening. I know it's not under this, but can you refer me somewhere, or
we
what
can get
I do?
you where you need to go.
Yes, definitely. Okay, and speaking of things outside of the OB-GYN world, which also does fall in there, what about colon cancer screenings, which is part of that too?
It is. So again, kind of going over all of your cancer screenings, colon cancer is still important to OB-GYNs. Your colon lives within your pelvis, and so that's still something that I'm concerned about. And then also with the genetic syndromes, colon cancer closely follows along with some ovarian cancer and endometrial cancer syndromes. And so we do keep an eye on colon cancer stuff as a GYN, and so that's an important part that we talk about at your annual exam. Have you had your colon cancer screening? Do we need to get that set up for you?
Okay, and what are the different colon cancer modalities for screening?
Sure. So you do have a couple of options. Traditionally, people think of the colonoscopy, which is, I think, is an excellent screening modality, and you have that performed in the hospital. It's an in-hospital procedure, but it's a day surgery procedure, and it's a good one. Depending on what the doctor that performs your colonoscopy finds, you can go anywhere between usually 5 to 10 years, depending on what your colonoscopy shows. Sometimes you need a little sooner, again, depending on your history, your family history, what's found. But you can stretch that out to 5 to 10 years at times. Other options that patients have are actually kind of at-home test collection kits that are becoming popular, and they are good tests for certain patients, again, depending on your history. And so those are at-home tests that you home collect and send it in to the company, and then your doctor gets that test result back. Those you can do, depending on which test you have, every 1 to 3 years even. So for some patients, that's a more comfortable option for them, and as long as you're getting your screening, I'm happy with that. And so if that's what you're gonna do, then let's do it that way too.
Okay. That's great information.
It is.
Yeah, and so if you just want to have colon cancer screening, again, if it's happened in your family, come to you and just talk individually, like to your doctor about that.
If you have a family history of colon cancer, it's definitely something to make sure your doctor is aware of, because you may need to start your colon cancer screenings earlier than just the average risk population. So that's something to talk about, depending on the family member that had it, how old they were, how many family members have had colon cancer. That can actually, again, bump you into a different category where maybe your screening's a little bit earlier, or your screening interval is closer together.
Okay. Are there any symptoms to look for that, or any changes that we might want to alert us to ask you about that?
If you notice blood in your stool, that's a very important thing to take note of and to take seriously, and to talk with your doctor about, or changes in your bowel habits, or changes in your ability to tolerate food. Those are all big things that you need to talk to your doctor about. Could be a lot of things going on, and so no reason to panic immediately, but to let your doctor know so they can find out. That's important.
Okay, that's good. And another thing, like we talked about, just if that's happening, think about everything too. What you've been eating and doing. Has your schedule changed? Are you not able to drink enough water, or get enough rest, or eat? Sometimes it may be that.
Absolutely.
So bring all of that information in to you.
Absolutely. I don't want people to set the alarms off immediately, but should be something that you bring up with your doctor, and don't just blow off every time it happens, especially if it's happening often. You need to talk with someone about that and make sure everything is okay.
And again, just go ahead, just ask those questions.
Absolutely.
Just
That's what your doctor's here for.
That's right. And take the time. A lot of time, I think, we'll come in sometimes with a list in our head, or we don't want to take too much time, and we don't know, but really, that is your time to talk about everything.
If it's your annual exam, that screenings is part of the annual exam, and so your doctor expects that. They set aside time for that, and so that is definitely the time to talk with them about cancer screening.
Okay. And what is the Gardasil vaccine?
Sure, that's a great question. Gardasil vaccine is very important to gynecologists, especially. Pediatricians also find it very important because they're often giving the Gardasil vaccine. So Gardasil vaccine is against human papillomavirus, or HPV, which is the virus that's associated with cervical cancer. We find that cervical cancer, over 90% of those cancers of the cervix are associated with HPV, which is 90% is a large amount. And so this vaccine was developed to try and prevent your exposure to HPV, or rather infection with HPV after exposure. And so if you receive this vaccine, the current Gardasil vaccine that's out right now protects against 9 different strains of HPV, which are the most virulent strains that are associated with cervical cancer. So with this vaccine, cervical cancer is now considered a vaccine preventable cancer, which is huge. And so I think it's very important that patients receive this vaccine and could drastically decrease their risk of cervical cancer. So important for patients to get it. I encourage all of my patients who have young children to have their children vaccinated, because ideally you vaccinate before there's any exposure to HPV.
Okay. So at what age? What is the...
So your pediatrician will definitely bring it up with you, but we consider around 9 to 11 is when we start vaccinating both girls and boys. If you are vaccinated before your age 15, then it's only 2 shots. If you're over the age of 15 when you receive your vaccine, totally fine. You're just going to get 3. And so it's not a big deal.
And that's it?
Yep.
Are there any side effects to this that they've seen, or?
No, it's a very safe vaccine. It's been out for many, many years. I remember I actually got the vaccine when it very first came out. I remember I was in middle school, and so it's been out for several years, and very successful vaccine that is starting to really make a dent in our cervical cancer incidents, and also just abnormal pap smears. We're seeing a lower rate of that, and we really feel like it is due to the Gardasil vaccine and the efficacy of that.
Yeah, and so like now with all this data now, it's been around a while.
It's very encouraging, and the hope is the future that cervical cancer becomes a very rare cancer, and that's definitely our hope, because it can be a very devastating diagnosis for a woman.
Yeah, and it can, and you to have a vaccine, potentially vaccine-controlled cervical cancer.
It's huge. It's huge.
You don't hear about that.
Yeah, it's great that you can prevent cancer just by vaccine.
Wow.
It's great. And so over 90% of cervical cancer. So are there certain types of cervical cancer that aren't related to HPV? Yes, but that's a very small number. So this vaccine is going to protect you from quite a large risk of cervical cancer.
So that's interesting too. There are different types of cervical cancer. There's not just...
There are certain types, and it all kind of depends, but the most common type of cervical cancer is going to be HPV related.
Okay. Yeah, I remember that coming out too. I remember that.
That was a big deal.
Yeah.
It is. It's still a big deal. It's a wonderful vaccine, and definitely something that everyone should be very interested in, for themselves, for their children. It's great.
Yeah, and this is very informative. I'm glad we're having this talk, because I remember HPV
glad to have it.
coming out. Thank you so much. It's because I remember HPV, and we were educated about that.
Yeah.
And they were saying you can take a shot, but it wasn't really stressed until this moment that I realized that was really a vaccine.
Yeah.
To help prevent cervical cancer.
That's
great. Pretty incredible.
Yeah.
That's really great. So what about Dex scans?
So DEXA scans are used to screen for low bone mass or osteoporosis. And so it's a special type of kind of like an X-ray imaging that we do of specific bones in your body, at your hip, at your spine, sometimes on your arm. We're looking at the density of your bone and to see, do you have low bone mass or osteoporosis? And if you do, then we need to know that so we can treat it.
Okay. And how are those scans done?
So it's a special imaging scan. It's very easy. It's non-invasive. It's a quick, again, kind of like an X-ray. You would be laying on a table, and very quick in and out. And those are typically started just for baseline risk at least at age 65. You should have a DEXA scan by that age. If you have certain risk factors for osteoporosis, we may be doing that DEXA scan a little bit earlier. And so again, same thing, I feel like a broken record, but you talk with your doctor about, do I qualify for that? Do I have risk factors? And should I be getting a DEXA scan now, or should we wait till I'm 65? And really it's individualized for the patient.
Yeah, because we always think about that's older patients that you check your bone density.
Sure.
We feel like brittle bones, or do
and that's very important, and it's real, but some women may have increased risk factors. And so we may need to do that a little bit earlier, because you don't want to not know that you have low bone mass and then have what's called a fragility fracture, which can be a very hard thing to heal from. And so if you know ahead of time and can be treating that either with supplementation or special medicines that can help build that bone back up, that's great.
Yeah. And what does that mean, fragility fracture? Is that what it sounds like?
Yes, yeah.
Bones?
So it would be breaking a bone after a very minor injury. So maybe if you trip from standing, you're not on a really high surface and you fall, you wouldn't really expect to break a major bone in your body, say your hip or your arm, if it's just a low impact fall. But if you have low bone mass, you may break a large bone, and that wouldn't be expected. And so that's considered a fragility fracture, meaning if your bone was a normal density, it wouldn't have broken. It may hurt, but it wouldn't have broken your bone.
Yeah, I've heard it said before that sometimes you hear someone fall and break a hip. Sometimes the hip is cracked before you even fall.
Right, it was
happening.
already kind of a fragile bone.
Yes. Okay, and what can we do? What are some things that we can do starting early on to strengthen our bones and good practice to prevent that?
Yeah, so there are certain risk factors that you can't change. So your age, your race, those are things you can't change. But things you can try to help is maintaining a healthy diet, making sure that you're active, and specifically weight-bearing exercise is important for bone health. Studies have shown that women who have weight-bearing exercise in their early 20s actually have much better bone health later. And so young women even need to be considering this and making sure that they're exercising on a regular basis. But even if you're not in your 20s, it's still important to have weight-bearing exercise that will continue to have your bone health improved. So diet, exercise, avoiding excessive alcohol intake is also important, and not smoking. Smoking is definitely associated with low bone mass, and so that's something that I always encourage all my patients for a multitude of health reasons, but bone health is one of them.
That's really interesting. I'd never heard that smoking could do that. So there's more reason to talk about that later. We don't think about too. We hear things, not as much alcohol, moderation, smoking, and we think it's just the typical, lungs, or just don't smoke because it's not good for you.
Right.
But it can affect so many things in your body,
It affects your whole
right?
body. Yes, smoking does. Actually, smoking is also associated with cervical cancer.
Really?
I know. A lot of people are surprised by that. And so when I talk to my patients about smoking, I tell them it really, truly affects your entire body. Absolutely, it affects your lungs, and that's the kind of first thing that comes to people's minds, and it's very important. Of course, your lungs are essential for survival, but it can affect every single part of your body. So smoking and quitting smoking is very important.
Quitting smoking, yes. Gosh, you just don't think about
I know
these things, and that you're helping so much by quitting smoking.
You
or
are,
alcohol intake, the foods you eat, everything. It's not just that specific thing. It can all kinds of things that we don't think about. We don't know.
Right. Yeah.
And more exercise, and lots of water, all those things.
all the stuff.
These things that really aren't that hard. Just really don't have to change your whole thing, but just that we've been hearing forever.
Yeah.
Move around.
Setting small attainable goals is always important.
Yeah.
Maybe if you have several things you need to work on, setting a small goal to do this week or this month, and then once you meet that goal, okay, I'm going to do the next thing. That's how I always counsel people to do things.
Absolutely. So movement in your day, movement in your life. You're feeling stuck, to get out and go for a walk. There's really so much more to that than just getting out and getting some fresh air, and just drink one more glass of water.
That's right.
If that could help prevent cancer and everything else in your body, it's really good to know all of that stuff and just enjoy your life a little more. Tell us really quickly a phone number, how we can reach you. I know our viewers are watching and taking all this information, and they've got this. We've been putting your information across the bottom of the screen. Yeah, it's all out there. So, and we can reach you.
Yes, so our office, you can call our office. It's 318-212-3890.
Okay.
We also have a website you can get on, and Facebook page and Instagram, so you can get a hold of us in a lot of different spots.
That's great. And it's always so helpful. Like in this specific question, and when you don't know, you can refer us to somebody else.
Absolutely,
It's so helpful, always. Is there anything that we haven't touched on, or anything you want to talk a little bit more about to leave our viewers with today?
would be remiss if I didn't mention that I think everybody should be getting their COVID vaccine. If we're talking about wellness, I'd certainly encourage all of my patients to get their COVID vaccine, to consider getting your booster, especially my pregnant patients. That's extremely important. And so if you're pregnant, you need to be talking with your doctor about getting your COVID vaccine. And also don't forget it's flu season. And so everybody should be getting their flu shot, whether you're pregnant or not. You should be getting that as well.
That's wonderful. Thank you so much to leave us with that. And we really enjoyed talking with you. It's been a pleasure meeting you. Thank you for all the information.
Thank you. It's been great.
All right. Thank you so much. All right, everyone. Thank you again for joining us for Healthline 3. We'll see you next time.